welcome to today's edition of Head Talk with Fifi. My name is Steven Sabla Ansan, aka Fifi. Now, today we'll be talking about a very important disease that is affecting the young ones in our community. Now, today I have with me a medical laboratory technologist who will be talking about this illness and their treatment. Okay, so now I have with me Miss Rosemary Duma Ansan. You are welcome to this program.
Thank you very much.
Oh, okay. So today we would like to talk about UTI because there are a lot of questions coming that they want to know, they want to find out if what is actually UTI.
Okay, thank you very much for your question once again. So when we say UTI, urinary tract infection, that is the full meaning. So there are any infections that affect our urinary tract system. So let's look at how our urinary tract system is. We can start from the upper, talk about the two kidneys, which produces the urine, then our two ureters, the bladder, and the urethra. So any infection that will affect these parts, we call those infections urinary tract infection.
Oh, okay. Thank you very much for the explanation. And someone also asked, she was saying that what actually causes it?
Okay, UTI, there are many organisms that causes UTI, but the main and the common one that we have or we know is Escherichia coli or E. coli. It's a bacteria. Yeah, there are other bacteria to that causes, but the common one among us is E. coli.
Okay, thank you very much. And someone was also saying that what are the symptoms? How is she going to know that she's having UTI?
Okay, so for UTI, it's present with dysuria. When we say dysuria, it means painful urination. You can also have oliguria, which means voiding small amounts of urine. Then we can have urgency. You feel like urinating a bit by bit, like every minute you feel like urinating. Then there's frequency too. Yes, and I think yes, that's all.
Oh, okay. So someone was asking that if they have this disease or this UTI infection, how are they going to treat it? Can they just buy any medicine and drink it and it will vanish, or there are certain medicine that needs to be taken?
That's a very good question. So for UTI, we can diagnose it by clinical manifestations. So a person comes to the hospital, you present the symptoms I've mentioned, dysuria, either dysuria or oliguria, urgency, painful urination, or maybe sometimes you have a blood in your urine when you urinate. So a doctor will request for laboratory investigations or analysis. So when it comes to the lab, we have urinalysis. First of all, we do a microscopic examination to see if your urine is clear or it's cloudy, it's hazy. Can I see blood? Then we have a chemistry test which can determine whether there are leukocyte esterases found in the urine, nitrites, if there is proteins or any other. Then when we get this information, we further or we probe to culture and sensitivity test. For that one is the gold standard for diagnosing for UTI. So when we do the culture and the sensitivity test, we actually find the specific organism causing the UTI, and even comes with a drug to treat it.
Oh, okay. Exactly. So it means we have to know the organism
exactly
that is causing it before a drug can be described for the patient.
Exactly. And let me mention this. We are saying bacteria, not only bacteria causes. In some times there is parasitic or fungal, but commonly the bacteria E. coli causes the UTI.
Oh, okay. Okay. So any advice to people out there who don't even know they are being affected with this, or normal layman who doesn't know anything? Any advice to that person?
Okay, so what I would say is good personal hygiene. First of all, you have to know how you keep your washrooms very well, Because these bacteria, they are normal flora, but they are opportunistic. So the little thing, it causes a disease. And for ladies, I would say that when you visit the washroom and you are cleaning, you start from front to back, not back to front, in order not to introduce any from the anus to the private part or to the vagina. And those that doge should put a stop to it. Ladies that use vaginal creams, remember these vaginal creams can kill the lactobacilli, which protect you from infections. So when they are dead, it means they pave way for any infections to occur. Yes. And one important thing about UTI, you don't keep urine. When you feel like you need to void it out. Yeah.
Thank you very much, Rosemary Duma Ansa.
You are most welcome.
Yes. So, as we all heard what Rosemary Duma Ansa said, I believe she has already explained everything. So, I guess we'll meet again. Don't forget to like, comment, or share. You can also bring your ideas so we all use it to do or to live our daily life. Thank you very much. Bye-bye.